Hello, and welcome to the Millennial Nutritionist podcast. I'm Isla Garcia, master's degree of nutrition science and registered dietitian, and I'm going to make weight loss realistic, sustainable, and uncomplicated for your busy lifestyle. On this podcast, me and my team of registered dietitians will decipher the latest nutrition research, dissect fad diets, and discuss social media trends for you so you can feel confident knowing what to eat to achieve your health goals. Research suggests that most weight loss programs aren't successful, but my experience has taught me that this is not because the participants aren't committed. It's because those diets are designed by non-nutrition professionals and center around severe restrictions. We are here to provide the facts about the science of weight loss so you can have the success you want and continue living your best life. Hello, it is Isla, your founder, CEO, and host of the Millennial Nutritionist podcast, and I'm really excited to present to you today's podcast episode because it's all about dairy. A while back, I went to Nashville on a trip with the Dairy Alliance where we got to tour a dairy farm and learn all about dairy and, of course, why it's important, which I already know, but mostly it's just more about the Dairy Alliance and what they do. And it's really just about encouraging people to eat and consume more dairy because we know it's so healthy for us. And the awesome thing is that they have a lot of dietitians on their team. So I know that I can trust all the information they give, and I know that they have the same passion and heart and training that I do. So it's just really awesome to meet somebody I trust that I connect with in that space. And if you know me, I've always been a big dairy girly. This is a paid podcast episode. So just full disclosure that it is a collaboration with them. However, I really enjoyed working with them. So just know that it's nothing where I had to feel bad about taking compensation for doing this interview because it's something I would have done anyway. But I want to talk to you a little bit about Callie, who is our interviewee. She is a registered dietitian and assistant director of community wellness at the Dairy Alliance. She is an advocate for a sustainable food system that meets health, environmental, and social needs. In her role, she fosters partnerships with universities and health professionals in the Southeast to educate on the role that dairy foods play in a sustainable diet. Along with this work, she promotes the health of dairy foods through TV, online, and print media outlets. So we're going to bust some myths for you on dairy. I'm going to talk a little bit about the things that I see as far as like what I feel like helps with dairy, helps people when they consume dairy, but she's going to bring in her expertise because this is what she does day in and day out. So I hope you enjoy today's episode. Thank you so much for joining us today, Callie. How are you?
I am good. I'm good. It's a sunny day here in Richmond, Virginia. So I'm excited to get out and spend some time in the sun soon.
Oh, good. Yeah, I was going to ask where you were located because I remember we met in Nashville, but then I couldn't quite remember where you were. What is like the temperature in Richmond right now?
Hot.
Oh, really?
My weather is stressing me out because it says above normal. That always is stressful to me. It's
Yeah.
80 degrees, it says. So it is
Oh, that
warm.
is warm. Yeah,
Yeah.
because I'm just adjusting to being in Charleston, South Carolina, where it's
Uh-huh.
today, I think it's 80, and I was
Okay.
thinking that that's hot, but I didn't think it was like that everywhere. But
Right.
yeah.
Right. Are you liking Charleston?
Yeah, I'm excited. Like, I don't know, it's nice to just be like tomorrow I'm meeting up actually with like a friend from kindergarten because I was from here but moved when I was in like third grade.
Okay.
And I'm gonna meet with her kids on the beach. I'm like, okay, this is what
Oh,
Charleston's
that's so
about. I
fun.
know.
Yeah.
Getting to go on a Friday to the beach. So yeah, it's been
Because
nice.
it'll be your first summer,
Yes.
right?
Yeah.
Okay. Yeah.
Yeah.
So fun.
All right, well, let's dive in because I feel like this is a meaty topic. I'm so excited to talk all about dairy today. I've been so excited. I was connected through Sarah, and I was actually so excited when she got that job because this comes up all the time. I'm a huge defender of dairy. I like probably already had like 5 servings today. I'm like one of the weird people that just drinks it like out of the jug. I love dairy.
Yes.
And so I'm excited to kind of like talk about it and maybe bust some myths. But first, I wanted to have some like preliminary questions so our audience even kind of knows what we're talking about. So first, can you or even us together maybe like define dairy so people know what we're talking about?
Sure. So me specifically, I work for dairy cow farmers. So when I talk about dairy research and whatnot today, I'm really referencing dairy things like yogurt, milk, and cheese, and kefir as well. We talk about
Mm.
that. Those are really the primary kind of dairy foods that I'm talking about, coming from cow's milk.
Gotcha. Okay. And then just a really obvious question, but again, just to frame our conversation, why shouldn't we avoid milk, do you think?
Yeah, so I guess I should probably take a step back a little bit and share about myself. And so I'm a registered dietitian and I work for the Dairy Alliance, which basically is a nonprofit. And we are based in the Southeast. And so I kind of see my job as helping to be the liaison between our dairy farmers and the public. So we know that not a lot of people have the opportunity to be in touch with the farm. That causes a lot of fears and concerns because nobody really knows what it looks like. And so I have that privilege to be able to create that connection. So bringing people out to farms, going to them, maybe it's like a virtual tour. And then of course, as a dietitian, tying in that nutrition information. So I am backed by all the research that's happening at National Dairy Council and able to really share that, so I can help bust some of those myths. So when it comes to, why should we avoid or why shouldn't we avoid milk and dairy? I think I could obviously spend a long time talking about this.
Yeah.
But I will say that when I started working for dairy farmers, I formerly worked in clinical. So I worked
Okay.
for 5 years as a clinical dietitian, and I actually took care of transplant patients. So people that were getting organ transplants, so kind of like very far from public health. I mean, these are people that were, um, you know, really intense nutrition needs. And now I'm on the other side of things, working with public health, working in industry. And, I love this job because it's been able to help me find my passion as a dietitian. And when I tell people, what am I passionate about, I'm an advocate for a sustainable diet that promotes both human health and planetary health.
Mhm.
And I realized that working for the dairy industry is really a good fit for me because it's a really good story to tell.
Mm.
And so specifically when you look at milk, well, milk and dairy as a whole, why should you not avoid it? I guess like my very broad answer would be is that I think it fits into a sustainable diet.
Mm.
And so I think a lot of people think sustainability, they think the environment, but as dietitians, we think about what's sustainable for human health. And so I hope to kind of share some studies that, I kind of use to help reference that discussion when I'm talking to people, whether it's future dietitians and whatnot. But yeah, that would be my broad answer, is that I think it fits into a sustainable diet.
Yeah, I love that. Yeah, I was going to ask, like, so what do you mean? Because I think for the majority of people listening that might think sustainability, think the environment, which we might be able to touch on. I'm always afraid with that topic, but maybe you have some. But there's also, like, I tell people, like, I focus on weight loss. I'm like, we need to think like a sustainable weight loss plan, not just something you can lose 10 pounds in a week. And so it sounds like you're kind of saying the same thing. What's something you can like keep up with that is healthy, not just healthy and like really intense for a week? Is that what you're kind of saying?
Yeah, well, I mean, I kind of am referencing, and I don't want to get like too in the weeds here, but
Mhm.
the FAO UN
Mhm.
has like a definition for like what a sustainable diet is.
Mhm.
And it factors in so many other things other than just the environment,
Mhm.
right? So if we're only taking the environment into account and we're thinking about our diet, um, I don't know if this is crass, but I always think someone told me this once and it has never got out of my head. Like the most sustainable diet is like an all water diet,
Okay.
right? Because like you're not creating any impact on the environment. Well, I guess you're using water, but
Yeah.
so that was something that was new to me in this role, is really learning about all the facets that go into sustainable diet. Like, does it support the community? Does this diet that you're promoting support human health? Does it support, like, is it sustainable long-term for the environment? Is it sustainable for the workers? I mean, there's just like so
Mhm.
many facets that it was something I never thought about
Yeah.
before I took on this role. And so it's really helped guide me and realize where my passion lies and try to help have that conversation. Although I hope it's not too like too
Yeah.
out there for
I guess
today.
I didn't think about it like that. And I'm, yeah, trying not to get lost in the weeds there either, because I think that's a really great topic that we could probably talk forever on, and just thinking like
Mhm.
overall, because that's what I try to get people to think of, like the overall picture with sustainability,
Yeah.
just like this one thing and maybe how much water I feel like people get stuck up on, or something like
Yeah.
it takes. But okay, good answer. Another question with that is specifically like what can milk help us with, do you think, in nutritionally or whatever,
Yeah. So
or dairy?
we know that like adults and children 2 years of age and older who meet dairy recommendations are less likely to be below recommendations for a number of essential nutrients. So that includes calcium, magnesium, phosphorus, protein, riboflavin, vitamin A, vitamin B12, vitamin D, zinc, potassium, selenium, and choline. So that was a long list, but as compared to Americans who don't meet dairy recommendations. And when we talk about dairy recommendations, I'm specifically talking about the dietary guidelines for Americans. So the most recent dietary guidelines for Americans, which are basically guidelines for Americans on how to follow a healthy diet, they recommend low-fat and fat-free dairy foods like milk, cheese, and yogurt as part of a healthy eating style. And healthy eating patterns that include low-fat and fat-free dairy food has been linked to health benefits like reduced risk of cardiovascular disease and type 2 diabetes. In addition, dairy foods have been linked to improved bone health, especially in children and adolescents. So there are a lot of benefits out there. Milk, dairy, we can talk more kind of with some of these subsequent questions, but just an easy way to get in those nutrients that we need to support human health.
Gotcha. Yeah. And I was even thinking like, because my specific population I work with is weight loss, and like even most of the people that listen to this podcast, like I was thinking how sometimes I talk about dairy, and a lot of times like it's the protein items that I recommend.
Yeah.
They're normally really, the people I work with are like really busy millennials, and I'm always recommending like cheese sticks, yogurt, and seems like those are really kosher for like people. I enjoy those products. So I was even thinking just like how easy it seems like dairy is to consume in a healthy way, like you were saying.
For sure. Yeah, I think it's can be really portable. I think that even just personally, like I am not a big meat eater. I actually just listened to your podcast from last week, or I don't know if it was last week, but your last podcast, and I was like, yes, that is me. Like, and I did when I had children, start eating more because it just was better for our family in terms of like, anyways.
Yeah.
But I like without dairy, that is like my protein savior. Like, Greek yogurt, cheese sticks, and all that good stuff.
I was thinking too, like what ends up happening with the audience I feel like I have and the clientele that I have is like they end up just like wanting to substitute everything single dairy thing. And I see it as like a trend too. So on the flip side, thinking like what would happen if we end up replacing like every dairy product with a substitute? I didn't even know like societally what would happen, like even health wise,
Yeah.
what happened?
There's actually a 2020 NHANES programming study. It was published in the Journal of Public Health Nutrition in 2020, and it looked at what would happen if we replace dairy nutrients with non-dairy foods. And it's possible to do, right? You can find dairy nutrients in other foods, but what they saw was there was a considerable increase in cost, considerable increase in caloric intake, and food volume to do so. So that's just like a programming study looking at kind of a what if. But I think as a dietitian, yeah, I will say you can find dairy nutrients in other foods. But I think what you want to consider for you and personally is like, how realistic is that?
Right.
If you are cutting out dairy, like, I don't know, you hear oftentimes like leafy greens are a source of calcium. Well, like how much leafy greens do you have to consume to get the same amount of calcium that you're getting from a cup of milk? Kind of one of those examples. So I think that yes, it can be done, but when you start looking at the logistics of it, you really start to realize like how nutrient dense dairy is and just kind of how it's a convenient, affordable, calorically efficient way to get in some of those nutrients.
Yeah, I totally agree. I feel like I'm always trying to show people like you can totally get the oat milk latte at Starbucks, but when we look like if you're trying to cut calories and like get more protein in, I'm always like telling people like dairy might be the best way to kind of get that done for you and your goal. If you love oat milk, go for it if you like the taste, but let's not be thinking it's like going to help you with some other goals that you're looking for. So I feel like you're kind of that. And then last like kind of preliminary question is on the flip side, is there any circumstance where somebody should absolutely be dairy free, just so we can kind of clear that up?
Yeah. So if someone with a milk protein allergy cannot and should not consume dairy. This could cause a serious allergic reaction, and this person would want guidance from a health professional on how to navigate that milk protein allergy. But it is important to note here that a milk allergy is very different from a lactose intolerance, which sometimes people do get mixed up. And so I say that just because, well, especially with us being in the Southeast, because of our demographic, lactose intolerance is really high. A lot of people in the Southeast have lactose intolerance. So a lot of my job is figuring out, like, how do we make milk relevant to people that are lactose intolerant? Like, how do we, you don't want to be tone deaf and just be telling someone who's lactose intolerant, hey, just drink more milk. Like, that is not great. So, but there are still ways to consume dairy, even if you have lactose intolerance. So, and not only is there, it's recommended. So of course there's lactose-free foods. So there's lactose-free milk, even a lot of the value-added products. So like the shakes and, like Fairlife, they're just making lactose-free now. And then there's also other dairy foods that people don't often realize. So like hard cheeses, sometimes are very, very low in lactose. So those can be a way to incorporate dairy in your diet without high amounts of lactose. And then fermented dairy foods, there's research to show that those may be better tolerated by people who have lactose intolerance because of that beneficial bacteria. So yeah, taking a step back, yes, some people have to be dairy free because if they have that milk protein allergy, but for those that maybe just have lactose intolerance, certainly don't have to eliminate dairy altogether. And I really wouldn't recommend it because, kind of as we've been talking about, it is a source of so many important nutrients.
Gotcha. Okay. Well, I feel like that kind of feeds into our first myth. So we have some myths I've collected for my audience, and then also just things I hear all the time. And we're going to work through some of them. So first one that I hear all the time, plant-based milk is better for the environment, which I feel like now is even controversial, but I think some people still think that. So maybe let's talk about that for a minute.
Yeah, so they did a modeling study at Virginia Tech, published in 2020 in the Journal of Dairy Science, that looked at what would happen if we removed dairy cows altogether from the US food system. And what they found was that if you replace the land used to grow feed for those dairy cows with land used to grow feed for humans, they saw a 57% decrease in availability of vitamin B12 and a 54% decrease in availability of vitamin D. This is just kind of like for the population as a whole. And they estimated that the reduction in total US greenhouse gas emissions to be less than 1%. So current research shows that dairy contributes around 2% or a little less than 2% of the US greenhouse gas emissions. So you can see that there really wasn't a huge difference in terms of environmental impact, but there was a huge difference in nutrient availability. So I think that that's a great study to just have that conversation. Of course, again, it's a modeling study, just kind of looking at the what ifs. But it's an interesting way to kind of get that conversation going at, sure, we get rid of all dairy cows, but then what? Like, what really is the outcome of that? And it's really hard to compare plant-based to milk to that because, again, I don't want to get too complicated, but you're looking at like life cycle assessments for them to evaluate like their impact, right? For them to measure their emissions. And so I'm not sure, like, I don't know what other, plant-based individual companies have done to kind of, what does their life cycle assessment include? You know what I mean? Like, are we comparing apples to oranges? And I'm truly saying, like, I don't know. But I do know that when you look at current like impact that US dairy is having in the environment, it's less than 2% of US greenhouse gas emissions. And then I just think this study is interesting to kind of have that conversation when they saw that when you took away the dairy cows, they really only saw less than 1% difference. So
gotcha. And you're saying like that you like when you compare the same amount of land for like it would take to have both like a dairy cow and then like what you were saying, like the materials to make what, like almond milk or something, you're overall getting less of those nutrients for the same amount of land. Is that right?
Well, no. So one concern from people they'll say is we're using all this land to grow food for cows that could be for humans, right? And so the study, what they did is okay, we're not going to do that. So this land is now being used to grow food that would replace like, I don't know if it's nutrients now, I need to nutrients or calories, but basically like it's being used now to grow food for humans, not
Oh,
necessarily plant-based beverages, like, but just food for humans.
okay.
And then kind of what was the impact of that? And that's kind of what the study showed. So the take
Interesting.
home is that the study showed is that really you saw a significant decrease in the nutrients that were available to humans and not that much of an impact on the greenhouse gas emissions.
Yeah, I feel like it was a big. I had a dairy, or not a dairy farmer, a beef expert, I guess, from Texas A&M come on and talk about
Mhm.
too, and that was kind of the same thing. And I think it's a big thing people miss is like that, like the overall nutrients that what we're looking at. I think as dietitians, we kind of realize that on a population level, like we also need to think about how much nutrients are we getting from this, like sacrifice of the greenhouse gas,
Mhm.
which sounds
Yeah.
from dairy we just get a lot.
Right. Yeah. And I heard you kind of some talking points just, and I don't know beef intimately, like I know dairy and I try to kind of stay in my lane,
Right.
but in terms of, considering, I think that there's some misconceptions that, animal ag is like this biggest contributor of greenhouse gas emissions when you really look at EPA emissions, like you can go to the website right now, it'll show you a different story, that transportation, electricity are really high up there. And depending on the year, usually ag as a whole is around 10-ish%. I don't know what the most recent, they update that information. Um, so yeah, but I think sometimes we see data, global data definitely is not going to look like US data,
Mm-hmm.
so I think sometimes I try to, because I always think of how I thought of all this before I started
Right.
working in
Mm-hmm.
ag. And I was skeptical for
Yeah.
sure. Like, because you see different numbers, like you see different information, right?
Mhm.
And then you think, well, okay, this person that works for the dairy industry is telling me
Big
that
dairy.
they're doing so great. And it's like, of course they are.
Yeah.
But it is, so I try to explain like where some of that disconnect is coming from. And sometimes it's, yeah, if you look at global data, like US farming is like amazing. We are like so advanced that what we're able to do and produce and like our efficiency is like it's amazing. And so that's not going to reflect, what's going on globally. And
Mhm.
so if we're using global research to kind of report on what emissions are with dairy, you're going to see that disconnect.
Gotcha. Gotcha. Okay. Um, moving on to a different topic. This is something I get too. People just like can't explain and they just say I don't like drinking milk or eating dairy because it grosses me out. What do you have to say
Yeah.
about that?
Yeah, I would definitely respect that. Like I always try to make a little joke. I had media this morning where I was on the local news and, talking about even if I am like recommending milk for adults, I'm just like, I get it. I know it's not popular,
Yeah.
but consider this. But also, my suggestion there would be, first of all, you don't have to drink milk. You
Yeah.
can get nutrients in other ways, right? You can choose
Mhm.
cheese, you can choose yogurt.
Mhm.
Um, Kefir, I think it still has a place. We definitely recommend it. I think it's a great beverage for kids. It's a great beverage for adults, but being realistic, a lot of what I do is also, okay, so what else can we do with milk? Because
Mhm.
a lot of the farms in the Southeast are, um, not a lot, most of our farmers in the Southeast, their milk gets processed into milk.
Oh.
So like, New York, maybe like a lot of their milk goes to yogurt, I think, Wisconsin cheese, but a lot of our milk is milk. And so a lot of what we're talking about, because we're supporting our farmers, promoting our farmers, is of course we talk about dairy, yogurt and cheese and all that too, but really trying to figure out, well, how can we make milk cool?
I feel like it's yogurt and lattes are hopefully pushing that forward or like
Yeah, yeah.
lattes.
That's right. That's right. So yeah, I think cooking with recipes, yeah, using it, using it in your latte, like
Mhm.
talking about the role that that can play. Smoothies are like
Oh yeah.
huge. Do a lot with smoothies, using milk and smoothies.
Okay, another one I feel like maybe this is the one I hear the most is that dairy causes inflammation. And sometimes I don't know if people exactly know what that means, but I just think they think it and then they think that they don't
Yeah.
want to have dairy because it's happening to them. So what would you say to someone who thinks that?
Yeah, I think that there's a couple things you could say to this. So one being that a lot of chronic diseases, when we look at chronic diseases, those are sometimes considered, not sometimes, those are considered kind of inflammatory states. So when you think of like type 2 diabetes, things like that. And the research shows that dairy is part of a healthy dietary pattern, like low fat and fat free dairy is actually associated with reduced risk of those, some of those chronic diseases. And then if you just look specifically at, when it comes to dairy, they did a systematic review in the Journal of the American College of Nutrition, and it was funded by National Dairy Council, but it evaluated 27 randomized control trials and found that dairy foods, whether it was milk, cheese, yogurt, and dairy protein, so whey and casein, had neutral to beneficial effects on inflammation.
Oh.
So this would not be the case if you have a milk allergy, but outside of that, there's really not evidence to support this claim that dairy causes inflammation. So yeah, that's what I would say to that.
Interesting. Yeah, I went to that's the most complicated name, the training for obesity management this past year. And talked about it was really interesting because there was so much new research out about obesity, especially with like all the new medication stuff. But anyway, they talked about like inflammation in the brain from certain things we eat or maybe causing people to be more obese. And they never talked about dairy. They did talk about sugar. So even just to like talk about, I think we can get inflamed from other foods, maybe, but dairy. So I just thought it was interesting that it maybe it does happen, and maybe then people get confused, and then it's talked about with dairy, and then they don't want to eat it. So I think again, maybe some validity, but keep on eating your dairy unless otherwise. Okay, so then on the flip side, the next myth: milk alternatives are better for you than actual real dairy. What about that one?
Yeah, so I guess I will say that milk alternatives can fit into a healthy diet, but what we do know or what the recommendations are is that it's not a replacement for real dairy milk. So if you look at the dietary guidelines, they do state that consuming many of these plant-based alternatives like almond, rice, coconut, etc., doesn't contribute to meeting the dairy group recommendation because the nutrient content is just not similar enough to dairy milk. That is the case for all plant-based beverages except for fortified soy beverage. So that's the only exception there. It is the most similar. It has the most similar amount of protein to real milk and whatnot. But so in terms of them being better for you, I think really just looking at that's kind of what the recommendations are, is that it doesn't fit into that dairy group recommendation that we see in the dietary guidelines. Also, while I know this is more pediatric focused, but it kind of shines the light on what other leading health organizations are saying about milk alternatives. And so 4 leading health organizations, including the Academy of Nutrition Dietetics, the American Academy of Pediatrics, the American Academy of Pediatric Dentistry, and the American Heart Association, recommend that children 1 to 5 years of age not consume plant-based milk alternative beverages except for fortified soy beverage. So their healthy beverage recommendations conclude that other plant-based beverages are not equal substitute to cow's milk. So, I think we've got leading health organizations that support the fact that milk is really the choice when it comes to being a part of that dairy group recommendation, providing those nutrients. When you compare like nutrient to nutrient, milk, you're going to find 13 essential nutrients in 1 cup. And while there's no standard of identity for plant-based beverages, so it can be tricky to compare, you're not going to get 13 essential nutrients in those other alternative beverages. And while you could have a whole conversation about naturally occurring versus added nutrients, most of the nutrients that you're going to find in milk are naturally occurring. A lot of what you're going to find in plant-based beverages are going to be fortified nutrients, which aren't always bad. I'm like not trying to knock fortified nutrients, but it's just a different beverage.
Interesting. Yeah. I feel like I was revitalized with this because I am pregnant. People know from this point, but I was like so excited to like maybe change up some things that I was eating based on like what's recommended for pregnant people. And like so many of the things that are recommended, I think all the micronutrients and stuff, I was like still surprised that are all in milk. So I think I was like, again, revitalized of like, oh, maybe I even start having more even just like straight up milk or dairy. Cause yeah, I forgot about all the micronutrients that are in milk too, that like had major for pregnant people.
Yeah, I mean, iodine is a huge one,
Mhm.
and like we don't have to like go into it too much. And I try not to steer away from it because I know it's not quite your audience,
Yeah.
but we have a lot of resources right now talking about how, I mean, milk has a ton of iodine in it, and that is great for brain development when it comes to you know, babies.
Yeah.
So we've been working with, trying to help spread that message with, pediatricians and pediatric experts just to kind of get that message out because I don't think, yeah, I think people think of milk and they think calcium,
Right.
bone health.
Yeah.
But there's a lot more to it, right? Even when you think about immune health, you've got vitamin D. Milk is a source
Mhm.
of vitamin D, vitamin A, zinc, selenium. All of those are important for supporting our immune function, but it doesn't always get kind of included in those
Right.
immune supporting foods. So
Yeah, well, we'll change that. Last myth that I am excited that you were okay with covering is that unpasteurized slash raw milk is healthier, which I'm so surprised because I feel like I'm from the country and a long time ago, I would randomly see this at like country farms. And I'm so
Mhm.
surprised that now I feel like I'm seeing it more and more on like TikTok and Instagram. So what do we think about this?
Yeah, I think that people often, I guess, I'm not sure why, people often think I'm an advocate for raw milk. I'm not sure why, but I'll get approached and be like, oh yeah, like I drink this raw milk, and I have to gently let them down that I do not recommend raw milk. About 150 years ago, Louis Pasteur developed the pasteurization process. And, a few decades after that process was developed, a New Jersey milk plant installed the first pasteurizer in the United States. And since that time and through today, with the exception of milks that are marketed as raw,
Mhm.
um, all milk in the US has been pasteurized. So this is one of the many ways that US dairy industry helps to ensure that milk is safe. I think that there's not really good research to support the claims for raw milk. And I will be honest, I haven't read that research personally, but the dangers itself of raw milk and like the risk associated is just not worth any potential in my mind because pasteurization of milk is not having a significant effect on the nutrition and the quality of the milk. And so when you're looking at a risk benefit, I don't really see any benefits and the risk is so high. So I
Right.
always recommend pasteurized milk. And yeah.
Yeah, because I don't know. I guess I don't know why people are wanting it. Or are they saying it's like the good bacteria is all killed off or something is like where maybe it's coming from?
Yeah, I guess my thought would be then if you want beneficial bacteria, consume
Right.
yogurt and
Yeah.
get beer. That kind of bacteria could be really could be really harmful. Um, I don't know if you've seen like that new TikTok trend that's been going on, and it's like all that work and what was it?
Yeah.
And
Yeah. Yeah. Yeah.
and like I forget how it goes, but it's like all that work, what was it for or something? And it's like a meme of Louis Pasteur like
Oh.
singing. And it's like after, people consuming raw milk these days, and it made me laugh and the thought about this interview. So
Yes. Okay. So hearing it from the expert, dairy is good, but we need it pasteurized.
yeah, for sure. And if you want bacteria, then go for a yogurt or
Yeah.
or
Gotcha.
a beer that has beneficial bacteria.
Well, awesome. I hope that we cleared some myths up for people and help people to be encouraged to drink more dairy or consume more dairy in general. But overall, if somebody is like wanting to learn more information, they want to go to a trusted source, where would you recommend that they go from here?
Yeah, I think it depends on what you're looking for. I mean, anything you can find information on our website, thedairylines.com.
Mhm.
Usdairy.com has really awesome, if you're nerdy and you are kind of curious about the science, they've got awesome science summaries. Like you can type in type 2 diabetes, blood pressure, you can type in or high blood pressure, you can type in inflammation, and it will link you to all the studies that kind of I referenced today in terms of chronic disease and how dairy relates. Additionally, you also will find farming information on there if environment is one of those concerns for you, or maybe
Mhm.
one of those reasons why you're not reaching for dairy. Also, just encourage you to talk to a farmer.
Mhm.
So I get it that hearing some woman talk about dairy and dairy farming is great and all, but for a lot of people, it takes going out to a farm. Like if that's the reason why you're not consuming dairy, then I would encourage you to try to find a farm that you can visit. A lot of farms are doing more agritourism, and I know a lot of our dairy farmers, they want people to come to their farm. Like they want people to see what they're doing. They want people to learn and understand because they're like, hey, we're working really hard and we really love our cows and we just want people to know that. So I think that I would just leave people with that. If you've got kids, it's a fun little field trip. Take your kids out to the farm and learn. But I think that's a great source of information in that realm. And then if you're looking specifically on dairy nutrition, we've got information on our website, thedairyalliance.com, but also usdairy.com has all those science summaries, which we might have linked on our website now, but just in case we don't, I wanted to share that resource too.
Awesome. Well, thank you so much for joining us today, Callie. This was a really fun episode, and I hope you have a good one.
Thank you.
Thank you so much for listening to the Millennial Nutritionist podcast. For daily weight loss tips and nutrition information, you can find us on Instagram at the.millennial.nutritionist and on TikTok at millennial.nutritionist. If you find this information helpful, please subscribe to the podcast and share it with a friend who needs encouragement on their health journey. See you in the next episode.